98.9, 67, 112 over 72, 1898. How many of you understand the meaning behind these numbers? I've just shared with you 5 different values, all of which represent a different vital sign. The very first thing I remember learning in nursing lab 4 years ago was how to take vital signs. Since then, I've learned an exceedingly large amount of information. However, this very basic skill has continued to be one of the most valuable pieces of information I've carried with me throughout nursing school. Over the next few minutes, I'm going to educate you on the importance of vital signs. I will demonstrate how to take vital signs, and I will inform you on what each value means or what it's measuring. Vital signs can be critically important. They may be taken every 4 hours, every 8 hours, or even every 15 minutes. Vital signs help us to monitor trends. For example, if you come into a patient's room at 8 a.m., take their vital signs and get a temperature of 98.6, which is normal, and then return at 12 p.m. and get a temperature of 100.2, you can see that the patient is running a fever, and this may indicate infection. Vital signs also help us to pick up on changes from a patient's baseline, or what is normal for that particular patient. Vital signs that are abnormal help tell us what areas of the body or what system we need to focus on, whether it be respiratory, cardiac, or cardiovascular. So when it comes to taking vital signs, you want to start with the least invasive sign and move on to the most invasive. This is to ensure that you can get as much information as possible if the patient were to become agitated or combative and you have to throw in the towel. I like to start with heart rate and respiratory rate. Heart rate measures the amount of beats your heart takes in 1 minute. Respiratory rate measures how many breaths you take in 1 minute. Usually, I would take both for 30 seconds and multiply by 2. However, in this situation, I'm going to look at both for 15 seconds and multiply by 4. So I'm going to take my pointer finger and my middle finger and place it on the patient's wrist on the side of his thumb. Now I'm going to hold it there for 30 seconds, but for 15, I'm going to be feeling for a pulse. For the other 15 seconds, I'm going to be watching his chest rise and fall. Now, usually the patient's thinking you're taking their pulse the whole time, and therefore they're not concerned about their breathing rate, so you can get a more accurate result. So I'm going to do that now. Alright, so I felt a pulse, 15, so I'm going to multiply that by 4 and get 60. So his heart rate was 60 beats per minute. His respiratory rate was 16 because I counted 4 breaths in the 15 seconds. Next, I will take the patient's oxygen saturation with a pulse oximeter. So I'll place this on the patient's finger, and the pulse oximeter is going to measure the arterial oxyhemoglobin saturation of arterial blood. Hemoglobin is the oxygen-carrying component of blood. So basically, to simplify things, this little thing on his finger is going to measure the percentage of oxygen circulating in his blood. So our result on our monitor is 98%, which is a good result. We want anything above 92, because anything lower can indicate some respiratory declining status. Next, I'm going to take the patient's temperature orally, so I'm going to ask him to place it under his tongue. I can also take a temperature axillary or under the armpit if the patient's asleep, if they have a lot going on in their mouth, or if they're combative, or rectally if need be if the patient's hypothermic. I'm not actually going to take a temperature now because of time's sake, but then I would take the reading and remember to record that. And finally, I'm going to move on to the most invasive, which would be the blood pressure. Blood pressure contains 2 values, systolic and diastolic. Systolic is in the numerator and diastolic is in the denominator. Systolic will be measuring the force of blood against the arterial walls when the ventricles of the heart are contracting. Diastolic is measuring the force of blood against the arterial walls when the heart is relaxed and when it's refilling with blood. That's why your systolic should always be higher than your diastolic. Both of these values are measured in millimeters of mercury, or mmHg. So I'm going to take my blood pressure cuff, and I'm going to make sure the arrow that says artery, I'll show you up close, is going to be pointing down to the center of the patient's inner arm, opposite the elbow. This is called the antecubital region. So what I'm going to be doing is listening with my stethoscope for when I hear the first heartbeat and when I hear the last heartbeat. The first heartbeat indicates the systolic value and the last is the diastolic. In the meantime, I'm going to be lowering the pressure in the cuff, and that is what is restricting and allowing blood flow. So I'm going to pump it up to about 180, and then I'm going to put on my stethoscope right over the antecubital region. And now I'm going to pump the blood pressure cuff up, and then slowly let out the air by turning the knob to the left. I heard the first heartbeat at 110 and the last heartbeat at 78, so his blood pressure would be 110 over 78. So today, over the past few minutes, I've shared with you the importance of vital signs and demonstrated to you how to take them while educating you on what each value means and what we're measuring. So the next time you decide to tune into your Grey's Anatomy or your Scrubs episode, you'll have a better idea of what the values are flashing on the monitor on the patient in the patient's room. Not to mention, you'll be better prepared when you're out in the community and you may be put in an emergent situation. Thank you for your time, and I hope you can carry this information with you.